The commonest injuries I see in my clinic at the Oaklands tend to be related to the hip and knee, so soft tissues that get damaged around the hip or the knee, for instance, ligament injury around the knee, or damage to the joint itself. I also do trauma surgery, so I'm happy to see any patient who feels they've got an injury related to sport, which is going to be dealt with by a sports surgeon. After an ACL is torn, it should be reconstructed as soon as possible. But the problem is there's often blood inside the joint, the patient's in pain, and there's swelling. So that all needs to subside. Once the swelling's gone and the range of motion is back and the patient has good muscle strength again, we can go ahead and fix the ACL. The earliest I've managed to do ACL reconstruction is around about the 6-week mark. The most challenging part about caring for an athlete with a sporting injury is that they can get frustrated from time to time. But I have to give realistic advice and make sure I take a long-term approach so that they can get their rehab done properly and they get back to what they really want to do. And though it can sometimes be really challenging, it's actually still the most satisfying part of my job. There are a number of good reasons why somebody should choose my clinic at the Oaklands for their sports injury. Firstly, I'm an experienced consultant, so I've been seeing patients for many years for these things. I would get the patient back on their feet as quickly as possible. I know when to operate and when not to operate and leave things alone, let natural processes take their place. The other thing is that over the years I've built up lots of experience treating footballers, rugby players and runners. I do sport myself, so I understand how important it is to get you back on your feet as soon as possible.